Welcome to all of you, and thank you so much for coming to today's exciting announcement. The beauty of being a Research One university is that every day there is something to celebrate. Some new knowledge that's being created, some discovery that is improving the world. And as you know, healthcare research is and always has been one of the key pillars of our University of Louisville School of Medicine. And our university has a tremendous history of basic and clinical medical research. For many, many years now, the Division of Infectious Diseases, which is a part of the Department of Medicine, has been conducting highly successful, highly impactful population-based research. And that's important, population-based research to understand what is the impact of infectious diseases on adults in our city. I wish that I could make you all do a drum roll because I'm that excited. I'm extremely honored. Hey, why not do it? You can do this. It's being live streamed. Let's do a drum roll. I am extremely honored to share with you that this work, this impactful work by our Division of Infectious Diseases, has led Pfizer, one of the world's leading pharmaceutical companies, to designate the University of Louisville Division of Infectious Diseases as a center of excellence for vaccines, medical development in all of North America. So what does that mean? This means that UofL is the first, and so far the only site Pfizer has selected to conduct studies of the burden of specific diseases that will be used to inform the corporation's own R&D of vaccines for diseases as varied and as impactful as pneumonia, diarrhea, and many others that affect adults and particularly the elderly. Something that I didn't really fully grasp or understand, and now it's been 19 months, so now I know, is that the population of Louisville pretty closely reflects the population of the United States as a whole. As a market researcher, I can tell you that it's important that you have generalizability of the sites that you study. So the research that's conducted in our city will assist Pfizer in the development of vaccines that are needed to improve the health of individuals, clearly throughout the United States. But the insights that are created will go well beyond our country to improve the knowledge about how these diseases emerge, evolve, and change all over the world. This information can be used by the Centers for Disease Control and Prevention, as well as many other government organizations, and inform and shape public policy regarding vaccination in adults. And it'll be so useful in global work that's aimed at preventing and treating these scourges in the world. We are exceptionally proud to be the first site to be part of this very valuable network. One key focus of our UofL work, as you all know, is we are fully committed to improve the well-being of people as they age. Optimal aging, healthy aging, we've declared will be something we are deeply committed to. And as you think about improving the quality of life for older adults, good health is a given. Without that, it's really difficult to have the highest quality of life one can. And vaccines that prevent these diseases, such as pneumonia, that often affect the elderly disproportionately, would improve and extend the quality of life for all of us. So all of you students and residents, this is for you. Right? As you age, the things that we are doing are going to improve the quality of life for current generation and generations to come. I have no doubt that this particular partnership will attract additional high-quality researchers and research grants and improve the reputation of our university at a national level. I do know, and this is important, that this work being conducted here beyond the health and human effects, has incredible economic growth and development opportunities. So as we think about lifting up communities, in addition to the health, we will be contributing to the growth and development for Louisville, for the Commonwealth, by creating jobs and educational opportunities in healthcare. What I look forward to the most, beyond this collaboration, is the impact that all of you will have. The impact on healthcare, and how do we improve this? Not just by treating specific disease conditions, but all of these are a way to ultimately improve the human condition. I want to thank our friends at Pfizer, and they are friends now. Yesterday, these would have been words on a paper that I would have read out. But I'm so pleased. I genuinely believe these are friends we have made for life. Dr. Cosero and Dr. Judar, for their confidence in the University of Louisville, as well as, and especially, we're saving the best for last, people, no offense, is Dr. Julio Ramirez, Chief of the Division of Infectious Diseases. And I know he will say, and my team. So we will always say, every time I have said Julio, he will say, and my team. So thank you, Julio, to you and your team for your hard work, skillful research, your navigation of the healthcare landscape. That's what has made this designation possible. Here's to a very long and fruitful relationship for all of us. Now, to dive a little deeper and talk to you about what this coordination and this collaboration and this designation mean, I am so honored to introduce to you an incredibly talented, incredibly gracious leader. I am so proud to have met her and so glad that now I will say she is my friend, Dr. Nanette Cosero. Look up her bio, people, for inspiration. But she is the global president of Pfizer Vaccines, and what an incredible responsibility and honor she has. As global president of Pfizer Vaccines, she's responsible for the development and delivery of innovative vaccines for diseases that cause serious and life-threatening conditions to the global community. So please give a big cardinal welcome to Dr. Nanette Cosero.
Wow. Good morning, and thank you so very much for your generous and kind words. It is true that yesterday we had the fantastic opportunity of getting to know each other, and totally agree that we have so many things in common, and I just saw it right now in the way you lead, in the way you think, and in our objective and mission of having a very profound impact on public health. So definitely agree with you that our friendship started yesterday, but will be a lifetime. So thank you for that. And thank you, Dr. Bendabuti, for having us here today at the University of Louisville and at this beautiful building, which is the house of state-of-the-art research. This is a home for some of the best researchers right here, including, of course, our own Dr. Julio Ramirez, who has been so instrumental in this collaboration between Pfizer and the University of Louisville. Pfizer and the University of Louisville has a rich history of working together, which started more than 20 years ago. I am so proud and honored to be here today as we launch the first Vaccine Center of Excellence network. The intent of this global network is to work with academic institutions, just like this one, University of Louisville, to conduct real-world research and understand the burden of specific vaccine-preventable diseases and the effectiveness of vaccines affecting adults. Our purpose at Pfizer is to develop breakthroughs that will have a significant impact in global health and that will change patients' lives. Our goal in vaccines, specifically, is to help protect as many people as possible from life-threatening infectious diseases across all stages of life. And this is something that is very important, all stages of life. As many probably of you know, second only to clean water, vaccination has made the greatest contribution to public health globally. Vaccinations are an essential tool to fight serious infectious diseases. According to the WHO, vaccination has greatly reduced the burden of infectious diseases globally, and they have also had a significant economic impact. Studies have shown that the timely use of vaccination and adherence to the WHO recommendations for infants, children, and adults have had a significant impact on reducing morbidity and mortality and have saved millions of dollars in direct medical costs to healthcare systems around the world. Sadly, vaccinations are often undervalued and underutilized beyond childhood. Therefore, this is an urgent need to expand the remit of vaccines to other stages of life course and at-risk populations, specifically among adults and the elderly. Many well-established surveillance systems have been developed for pediatric immunization programs and are currently in place and well used. However, the surveillance systems for adults are less developed and disease burden data estimates are less precise. Thus, the importance of why this partnership between Louisville and Pfizer is so critical. With a growing aging population around the world, the research as part of this Center of Excellence network will help provide us with a critical understanding of how direct vaccination may reduce the cases and consequences of life-threatening infectious diseases in adults. Our purpose is that by establishing more of these centers of excellence networks around the world and working with world-class partners like University of Louisville, we will be able to provide quality epidemiological data on disease burdens, which can inform and increase the number of public health discussions on this important topic. Thank you again for having us here today, Dr. Benveduti and Dr. Ramirez. I am filled with excitement and anticipation for what is to come of this fantastic partnership. So now I would like to introduce my colleague, Dr. Luis Godard, who is our Scientific Affairs Officer at Pfizer. Thank you.
Thank you. Thank you very much, everybody. Thank you very much to the University of Louisville. Obviously, we feel privileged that you hosted us and that you are hosting us here, Dr. Mendapuri. Thank you, Dr. Cocero. I think both of them have already said what I was going to say, so I'm just going to improvise and try to make some sense. What I really wanna, in my own words, again, trying to instill here is the extraordinary opportunity that we have here. So I've been in vaccines for 30 years already. I started at WHO and then later on in Asia. And you guys need to remember that in 1980s, there was only 5% of kids vaccinated. So for the entire 20th century, the impulse was to vaccinate pediatric populations. And that has saved, as Dr. Cocero mentioned, millions and millions of lives. Now you have around 80 to 90% of coverage of the most important infectious diseases in the pediatric populations. But what happens with adults? With adults, until the year 2000, 2005, adults were not considered, were not much paying attention around vaccination. Most of the attention of WHO and others were put into the infant populations. And as Dr. Cocero mentioned, there are very, very well-established surveillance systems already for pediatric populations, but in the world, it does not exist. So why this is just an extraordinary opportunity, but not only for the University of Louisville and Pfizer that it is, but for the world, because this is the creation probably of the first and most sophisticated population-based site that is managed by a world-renowned expert in infectious diseases. So you cannot just say, well, why University of Louisville, or why didn't you go to other places? I mean, it's extraordinarily difficult to just have the combination of have a brilliant leadership, Dr. Ramirez, Ruth, and their team. Of course, this is not only the work of a person, this is the work of a brilliant team. But at the same time, I think what makes it's not only the scientific excellence or the credibility that he has around the world, but also the extraordinary relationships that have been made with all the hospitals here in Louisville and with the community. So that's what it's almost a miracle to find around the world. You do not have almost anywhere in the world that combination. And that's why what we feel is that this is a project that, yes, of course, we are incredibly proud to partner, but hopefully this becomes a sustainable infrastructure and a sustainable project that overwhelms both Pfizer and the University of Louisville, and is a present to the world, because again, you cannot measure the disease burden. When we are saying, okay, I mean, what is the attack rates of flu? What are the attack rates of pneumonia? What are the attack rates? You cannot have those epidemiological studies exclusively in hospitals. You really need a catchment population. You really need a denominator where nobody escapes in order to have accurate, because after that, then you can have all sorts of risk conditions, and then you can measure interventions. Dr. Cotero said, well, we are developing vaccines, but it doesn't make any sense to develop a vaccine if you cannot measure the impact. If the government cannot say, oh my God, this vaccine is saving so many lives, is preventing so many cases. And that's what we hopefully are one of the goals of these collaborations with the University of Louisville, not only to discern what is the epidemiology of the diseases, but also what is the impact when a vaccine is licensed to the general population. And what is beautiful, and the other thing, it's true. I mean, some of the incredible features about Jefferson County is that resembles the ethnic makeup, resembles the socioeconomic makeup of the United States. So you can extrapolate the results from Louisville to the rest of the United States, and hopefully not only make sure that this data is taken by the governments and make recommendations or make guidelines on how to use vaccines, but also not only in the United States, but in the rest of the world. So I just wanted in these just 5 minutes, I could be here for ages, as you can imagine, but I'm sure they're telling me to cut. No, but seriously, I just wanted, you guys have been very kind to come down here and to listen. Obviously, take home that this is an extraordinary opportunity for science, for public health, and for the entire community of Louisville, and in derivation to the entire United States and the world, because the data that we are going, hopefully, or that Dr. Ramirez and their team are going to generate here are going to serve to measure the impact of life-saving vaccines for the next foreseeable years. And with that, Dr. Ramirez, I'm so proud and honored to present you.
The problem is that Luis can keep going forever, and I can go forever, and I'm the last one. No, but I was thinking just to probably indicate two things. We've been discussing this collaboration, this population-based research. I want to be clear that this collaboration between us and the scientists of Pfizer have been happening for more than 20 years. Then we have a lot of collaboration. What we're doing now is essentially we are reaching this center. We are stretching this collaboration, and we hope that this center is the beginning of something new. New in the sense that our idea is not just we are going to be just doing better clinical research. We hope that the scientists of the University of Louisville, the scientists of Louisville, our goal is to create new ways of doing clinical research that is going to allow us to generate new knowledge. And we're already doing this, just to bring some of these things into real-life situation. For instance, with some scientists, with Dr. Isturiz, a couple of years ago from Pfizer, we developed a protocol to look at pneumonia in the city of Louisville. In the city of Louisville, every year there are 92,000 populations that get admitted to the 9 adult hospitals in Louisville. 92,000 members of our community get admitted to the hospital. We look at for 2 years, and we figure out who of our population have pneumonia. And as was already alluded, then we figured out that there are 700 hospitalizations per 100,000 population. Knowing the population of the United States, we published that in the United States, there are 1.7 million hospitalizations due to pneumonia. And this data was originated in Louisville, and now we have data for the United States. Then this is population-based research. What else do we learn that we just published with this data? Here we learn, for instance, that we teach medical students that pneumonia is, bacteria is an infection, it's an acute infection of the lung. Well, now we learned that these patients that were admitted with pneumonia, we noticed that some of the patients were developed heart problems, and the patient would develop acute myocardial infarction. And we learned that you have pneumonia, but pneumonia affects your heart, and you have an acute MI in the case of pneumonia. You have pneumonia, and the patient was having a stroke, and you have a brain infarct in the case of pneumonia. Then now what we are learning now that pneumonia is not just an infection of the lung, it's a multisystemic disease. And we always thought that pneumonia is acute, you get admitted to the hospital, I give you antibiotics, you improve, you go home, everything is back to normal. No, because in Louisville, we follow the patients for 30 days, 6 months, 1 year after they were in the hospital for pneumonia, and we figured out that after 1 year, 33% of the patients were dead. Then we learned that pneumonia, somehow you have pneumonia, and for some patients, you decrease your life expectancy. Translated this into every day. I go now to the hospital, I see 3 patients hospitalized with pneumonia. 1 of these 3 patients is going to be dead in 1 year. Then we are learning that pneumonia is not just an acute process. It's a systemic disease, it's a chronic process. And all this type of learning is just happening in Louisville. And we can extrapolate this, as Luis mentioned, to the US and to the world. Then, and just then to close, since I see a lot of my team here, a lot of the research associates, and some of you hear this from me, that essentially, why is that we are so excited? Well, when we go to the hospital and we treat 1 patient, it's great. We do patient care, we help 1 patient at a time, and this is good. We're at the university, we teach fellows, we teach residents, we teach students, and essentially they are going to go and help patients, and essentially we are helping 10, 20 patients at a time, because we are teaching, and then the fellow goes and we expand our capability to help. With clinical research, we create new knowledge. This new knowledge advances medicine. And this advancement of medicine is going to help what patient with pneumonia? Everybody with pneumonia in the world. With clinical research, we are helping globally every person because essentially we learn, we publish, people get the publication, you change practice, and we move medicine. This is why clinical research is so exciting, and this opportunity with Pfizer is going to, again, as I mentioned, is going to allow us to do better clinical research and new ways to do clinical research and population-based research. For this reason, my team, because I've been discussing with all my team, would like to thank Dr. Bendapudi for her constant support for our research endeavors here at the university, and of course, Pfizer for selecting us. But also, more important, we mentioned the Louisville community that allow us to interact, to learn, to do research. And our goal is, again, we want to give back to the Louisville community, but at the same time, we know that we're not only helping the Louisville community, we're helping the global community. Thank you.